Welcome to Heart Valve Pressure-Mania. I'm Red Blood Cell Sports Guy, and we will watch as the heart chambers on the left side of the heart use their pressure to push against the heart valves in a contest of strength to see which chamber has the greatest pressure.
Hi, I am White Blood Cell Sports Guy, and this pushing contest against heart valves not only occurs between the chambers on the left side of the heart, but on the right side as well.
In our first two contests of this cardiac cycle, we start just after the last cardiac cycle has ended, before the P wave, and we will pit the pressure of left atrium woman against that of left ventricle man.
At the same time, we will witness a contest between the pressure of right atrium woman and right ventricle man.
In this contest, left atrium woman clearly has the advantage. Look at all of the pressure that she has been building up.
The same can be said for right atrium woman, who clearly has an advantage with all of her pressure.
Where did this pressure come from? Ever since the QRS complex of the previous cardiac cycle, oxygenated blood has been returning from the lungs through pulmonary veins into the left atrium. Its volume has been swelling and pressure has been increasing. This blood has nowhere to go.
The exact same thing has been happening on the right side. The right AV valves closed in the QRS complex of the previous cardiac cycle. Since then, the superior vena cava, the inferior vena cava, and the coronary sinus have been bringing deoxygenated blood to the right atrium, but the pressure in the right atrium continues to grow because this blood has nowhere to go.
As our heart valve pressure mania before the P-wave contest starts, left ventricle man has been using his pressure to keep the left AV valve, the bicuspid or mitral valve, closed. But that is about to change, because the great strength of left atrium woman's pressure is just too great. She overwhelms the pressure from left ventricle man and forces the left AV valve open. This allows blood to flow from the left atrium into the left ventricle.
The exact same thing is occurring on the right half of the heart. Right ventricle man has been using his pressure to keep the right AV valve or tricuspid valve closed. But as blood has accumulated in the right atrium, the pressure of a right atrium woman is just too great. She overwhelms the pressure of right ventricle man. This forces the right AV valve open, allowing blood to flow from the right atrium into the right ventricle.
Remember that heart valves open and close due to pressure alone. And when the pressure in the atria is higher than the pressure in the ventricles, the AV valves are forced open.
As a result, before the P wave of the new cardiac cycle even happens, we have our first event, in that the AV valves open, allowing deoxygenated blood to flow from the right atrium into the right ventricle, and oxygenated blood to flow from the left atrium into the left ventricle.
This has been an exciting first matchup in a new cardiac cycle of heart valve pressure mania.
Yes, but there are more matchups yet to come in this cardiac cycle.